Welcome to the People's Podcast, an employer's resource by Group Management Services. I'm your host, Alyse Kimble.
This podcast does not constitute legal or financial advice. Its accuracy, completeness, or adequacy is not guaranteed. Use the information at your own risk. Consult an attorney or financial advisor before taking any action.
Hello and welcome back to the People's Podcast. My name is Alyse Kimble. I'm the Training Development Manager here at GMS, and I am joined today by Amie Hatlovic. She is the Manager of Benefits Account Managers here at GMS, and we are going to be talking about all things healthcare renewal today. Whoop, whoop.
Yep.
I know this is a very important subject for a lot of our small business owners who are right now looking at the future. If they have January 1st renewal dates, this is kind of the time, right, that we come back and we start looking at our healthcare renewals.
Yes.
So let's talk about that timeline. If you were a small business and you're looking at maybe making a change this year, when would you really need to start getting a hold of maybe another broker or looking at the market and seeing what's available for you?
Actually, September is the time. If they want to go out and find another broker to start that process, most outside carriers won't allow quoting for like 90 to 60 days out from the renewal date.
Gotcha.
But finding that broker, this is fourth quarter, it's the busiest time of the year.
Yeah.
They need to get that process in place, and it does take that 90 days normally to get a full-on quote ready.
Wow. Okay. So it really takes that long, huh?
Yes, it does.
So once they get a quote, is that quote, if they want to look at other options, is that quote pretty good for a certain time limit, or is there a time limit on a quote, a healthcare quote, if they get it maybe from another broker or something like that?
If they get it from another broker, they'll usually release it 60 days prior, and they'll hold those rates for maybe 30 days. They do also take into account any kind of swing of enrollment, and they do claim that they could change their rates if there is that swing of enrollment.
Really? Okay, so they have more people join the company, they're eligible for benefits. Yeah.
Correct, especially if that open enrollment time.
Okay, good to know. Wow, I didn't even know that. That's crazy. Very cool. So if you're a business owner listening to this and you're looking at healthcare, this would be a really, especially at renewal time, if you've gotten your renewal, I would definitely be proactive here to try to find maybe another company or another broker to maybe partner with for a January 1st. So good to know. Mm-hmm. So when we finally get our renewal, maybe from our current broker, and it's maybe I have some questions about it. What are maybe some questions that when I get my renewal back from my current broker, should I be having a meeting with them and asking them questions about maybe the rates that come back, what's included, prescription fees? There's, I think, probably a lot of things you need to ask your current broker.
Yes, there
right?
are.
What are some of those things?
Well, just exactly what you said. Did the plan change?
Okay.
What are my other plan options on there? Are we still with the same network? Are they still with the same PBM, Pharmacy Benefit Manager? Mm-hmm. Those are the types of things that they need to ask, and making sure that they're doing apples to apples on there, because a lot of the outside carriers tend to change their plans on a yearly basis, and it could be co-pays and things like that will change also.
Gotcha. So maybe just going through the plan with your broker and making sure what are the changes, what do we need to be aware of, those kind of things. Perfect. How long does the renewal, if I were to go to a GMS maybe and get a quote for benefits, how long does that process typically take to get that quote back?
So internally with us at GMS, we typically start somewhere between 120 and 90 days. We are analyzing all of our plans across the board, and then our clients that are in those plans. And that's what will determine our rates. We have our actuary team and underwriting. We're looking at, always our claims, that are coming through, any diagnosis, any high claims. We're constantly monitoring that. So our renewals, we can reach out to our clients probably about that 90-day mark and anticipate maybe setting a meeting mid-month and usually mid-October. So we're really getting ahead of the game. Because we know everybody's busy.
Right.
And that also allows time for our clients, if they had a bad year and we come back with a usual maybe higher quote than we were expecting possibly, that gives them time to shop.
Okay.
One of the things that we see a lot is they'll get their renewals or they get them from their past experience of brokers and they're getting them at 60 days. Maybe they didn't pay attention right away, so now they're under the gun.
Yeah.
Now they're under the gun to get quoting done, whether that's having their people fill out applications, getting the census. So that is time consuming. Everybody's got to be on the same page.
Absolutely.
Which then you run into the holidays. We've got our Thanksgivings and Christmas, and it makes them feel very frustrated because they're rushed and rushed to make a decision.
Yeah.
That's why at GMS we like to start it early. We give it enough time. The benefit account managers are going and reaching out to them right away. We're touch basing them. If we don't hear from you in a week, we're going to be emailing you and calling you again.
Yeah.
Let's set this meeting. Let's go over these options.
That's fantastic. For business owners listening, they're probably like, wow, that's amazing.
Yeah.
Because I'm sure there are business owners listening who have had that happen to them at 60
I'm
days
sure.
and they didn't really pay attention to it, or they said they had time and then they were up against the gun.
Yes. We know that they have businesses to run. We
Yeah.
do understand that. But, this is very important because it is very time consuming and, time flies.
Absolutely. And this is one of your biggest costs
Yes.
as a business owner. So it shouldn't be something that, you have to rush to make a decision on. Should a business have a plan in place to make sure that they're doing everything they can to ensure that they're getting the best renewal possible at the end of the year? And what would that kind of look like for them?
Absolutely. Again, they're probably always analyzing their business costs. Well, benefits are the same. Make sure that you have a touch base with another broker. Making sure that you are going to be reaching out to them so they can shop out. A lot of businesses like to do that every year. It is a process. So they compare, the different plan options. And if they're with GMS, we're open to that too. We want them to see what's out on the marketplace. We have clients that maybe they have multiple plans. They have a traditional plan, an HSA. They kind of set on those type of plans and whatever the deductible are. Well, maybe there's not a lot of usage. Maybe it's time to look at maybe a higher deductible plan. Be open to those options. Make the time to sit down and to consider what is available out there. We also like to encourage a lot of the clients too, is maybe do things, to try to help the health of the group. Maybe push in like a wellness program, gym reimbursements, anything you could do to help your group. Hopefully that will help the renewals because we won't have a lot of claims that come through.
Right, absolutely. Being a little bit more proactive, right? Speaking of which, I've always just been curious about this, is there a benefit that you're seeing employees really like more than others?
In regards to plan options or?
Could be, yeah. So are you seeing that most people are really liking maybe a high deductible HSA versus a traditional plan nowadays? What are kind of the trends you're seeing?
When we introduce a high deductible healthcare plan and we educate on what exactly that means, because you hear high deductible and everybody's like, oh my gosh. They love the fact that they can do that health savings bank account. So that allows them to put in pre-tax dollars into this bank account. And, it's a debit card. They can do it with their bank. We work with a vendor here at GMS. When they realize that they can pay out less premium for the medical plan, but then put this money away in a bank account to save for any kind of medical dental expenses, they love it.
Yeah.
It's just understanding how that works and educating them. And once they get it onto that plan, versus let's say they were prior maybe on a traditional plan, they paid high premiums. It's, the cost sharing's up front right away on a traditional plan. They're like, wow.
And you don't get that money back either.
No.
It just goes.
Premiums, yep.
Lose it. I always think of it as we're talking about health insurance, but I really truly think of it as auto insurance. You don't see that money back again.
You don't. No.
It just leaves unless you have an accident and then you actually use it. So I always think of an HSA almost as more of a savings account, if anything. It's pre-tax, which is amazing, and you can use it on, prescriptions, or if you get sick, you go to the CVS, you need a prescription for something, you can use your HSA card for that. So I'm glad to see the trends we're getting educated a little bit more on it, and I personally love mine. So here at GMS, so I have to kind of plug in our high deductible HSA. What are some of the most common pain points businesses encounter during their renewal process?
Not prioritizing.
Okay, so we talked about like
Yes.
time frame
Time
before.
frame, not priority.
Okay.
It's time sensitive. If you have a renewal that's January 1st, that's your cutoff. A lot of times, they get caught up in, wrapping up our things in business, and next thing you know, time gets pushed off. They haven't met with us.
Yeah.
At GMS, as I mentioned, the benefit account managers are constantly reaching out. We want to set that meeting. It may not just be done in one meeting. We want to present it. We want to look at the plans. If it's something that's a little bit higher than expected, we want to say why. Mid-year, where we always meet with the client because we do an evaluation report.
Okay.
That evaluation report mid-year is going to show how the plan is running. We're going to see the top highest claim categories on there, diagnosis categories. If I'm looking at, I see maybe there's a lot of urgent care visits. Our plan, we have teledoc included.
Okay.
I'm saying to the client, well, maybe we need to do another educational piece and, remind these people they have teledoc.
Yeah.
Let's get that usage down. So we know what we're up against. If they're not prioritizing that meeting when we want to set it in October and it keeps getting pushed up, now comes the rush.
Yeah.
I know they're busy running their company, but this is part of that too. And it is an important part because it is a lot of a cost,
Oh, for sure.
and they just don't prioritize it.
Okay. So prioritize your healthcare renewal,
Yes,
guys.
yes.
We have to do that.
It's one time a year.
Absolutely. And we want to make sure we're getting on top of it. I love, and I just want to pin something you said here prior, is that you have that mid-year meeting, which I think is so important to be a little bit more proactive so that you're not just getting to that renewal time and you're like surprised by the fact that you've gotten a higher renewal. Whereas we could have gotten ahead of it in mid-year. And then by the end of the year, maybe we could have made some improvement to the utilization of the plan and not had to give as high of a renewal. So I think that's really important as well. You got to really treat your healthcare as a piece of your business, and you need to look at the health of it throughout the year to make sure that by the end of the year we're not getting just a huge cost increase.
Yes.
That we could have been maybe mitigated throughout the year. So what makes GMS a unique option? So we're going to shift gears here a little bit more to GMS. So what makes GMS a little bit more of a unique option than maybe what's out there in the open market? And how do we ensure that this isn't just another quote we're giving people? This is actually, something where we're looking at the health of their business and their employees. So kind of talk to me a little bit about how GMS is different than what's out there in the open market.
So when a client is going to come on with GMS, not only is it, what can we do on the side of, payroll, HR and that, but to combine the benefits part of that piece. So that partnership right there that's taken into consideration. On the healthcare part, we are looking at maybe what they're currently on, what their rates are. Clients are always looking, obviously, to keep costs down. At the very beginning, when we look at their plans, when we look at their demographics, when we are going to quote them on health care, we're going to give them realistic premiums right off the bat. Sometimes it's not always a big savings on the health side.
Yeah.
But what we do with that is it helps ensure that maybe the next renewals, we're not hitting them with these really high
So you price
double
right at
digits.
first.
Yes, we do.
Yes.
We're very transparent about that. One of the things that we hear a lot is, we're always getting slapped with these high increases. Well, a lot of other companies come in really low, so they make it look really attractive.
Yeah.
And of course, who wouldn't want to go on that? But then after they get the experience in the next year, they're seeing maybe 30% increases.
Yeah, and the option is to shop it out every year. That's really your only other option if you get a high renewal is, I got to go and shop it out every year. But that's so frustrating to your employees.
Yes.
To have new benefits plans every year.
Yes.
Have to learn okay, which one do I want to choose? Which covered options do I want? Oh, I had this last time and I loved it. That's not an option anymore. So that can be really frustrating for your employees when you shop it out every year.
Oh, yeah, and we hear that. But our retention on our clients' healthcare is amazing. I mean, we have had clients on our healthcare for probably 10 years.
Wow.
They do shop. They understand what's going to happen out there, and they know that we're a partnership. We are going to analyze everything, as a package deal. Again, your benefit account manager, if there's anything that's going on in that mid-year, we're going to we have to do something with this.
Yeah.
We have to help this out. Our plans are self-insured. They're administered by us. Everything's internal. So again, we can watch those things.
Yeah.
We can reach out to employees. We have cost containment specialists, that will help. If we have anything that's maybe cancers, that's a big one this past year coming through,
Right.
unfortunately. You have the support of the team here.
Yeah.
It's just not, here's your, medical, go on, have fun. We help the employees utilize the plan.
Yes.
That makes it way simpler for the client not having to deal with how do I have this done, reach out to your team at GMS.
Right. So if you're hearing this, business owners, you don't have to field those questions because you probably don't know them.
Right.
You have a full support team here at GMS, so they can reach out and ask the questions that are important to them and get those answers when they really need them. And nobody wants to mess around with trying to get somebody on the phone when you have a question about a cancer diagnosis or something like that. So, for sure. How does GMS just make it, I'm just say simple and better. So how do we make it a little bit more simple and better to have access to benefits and to have that be administered by somebody other than yourself? We just touched on that a little bit briefly, but anything else you would want to add?
So when a client comes on, they are assigned a designated benefit account manager, and it's actually a team or a customer support. We are in charge of your benefits. We are going to give you the renewal. We are going to walk through it with you. We are going to sit with you and analyze the plans. If you pick a plan or you change, we're going to work with you on contributions. That's the other thing is the employer contributions to the plan. Maybe they need to change. We help you calculate that. We'll work through that with you. Once you're decided what you want to go with, it's in our hands. We're going to implement it into our payroll system. So GMS Connect, we build it in there. We are going to facilitate the open enrollment. We do everything electronically, so it really makes it easy. If anybody's troubleshooting, they have their team.
Yeah.
We have an enrollment assistant line. We can do employee meetings, which is one of the things that we pride ourselves on. We call them employee roll-up meetings. We can go directly on site. We do virtual. We do a combination. We're there to ask, field the questions.
Yep.
Help people go through the enrollment.
Choose a plan, yeah.
Some people just don't like computers or they don't want to, go through that. But we're there. We're the advisors. We're handling it from start to finish until it's completed. We are looking then at, halfway through the enrollment period. Has everybody completed? Have they gone and done it? We're making sure that they get it done. They have their coverage. They understand it. They know exactly what's coming out from their paychecks. And that gives our clients peace of mind because they can go on and run their business and not have to worry.
Yeah, I love that. It's huge for sure. I always ask this at the end, but what would be something that you would want business owners to know about their benefits or about their healthcare renewal, maybe specifically, that we didn't touch on today that you feel is really important?
Well, healthcare in this country has changed. And I hear a lot from clients, being competitive for jobs out there. It's not only finding, the right type of employee, paying the right, but benefits are a major thing.
Huge part of it.
Huge part of it. For some of our clients, maybe they can't afford that medical, but that's okay because we have a lot of ancillary plans here at GMS that are at no cost to them. Yeah. They don't have to do any employer contribution.
That's amazing, by the way. Absolutely amazing that you have a full suite. We have so many ancillary benefits.
Yes, we do.
Full suite of ancillary benefits just through a partnership with GMS without having to take our healthcare. I just want to pause there. That is incredible for a partnership. to have access to that. And a lot of that is passed through. The employer can take on some of the cost of that if they choose
If they choose to.
And it's very inexpensive, right?
Correct.
So I'll let you finish there. But I think that is just a huge benefit of
Yeah.
a partnership with GMS.
So, in coming on to GMS, maybe they want to do healthcare in a different way. Maybe they give their employees, a stipend every month. They're out on the individual market. Maybe
Yeah.
they'll get to a point where they're like, you know what, I think we're at a position that we can do a medical plan. Let's see what the option is. But they can have all those ancillary benefits. Dental, vision, we have life, voluntary life, short-term disability, long-term disability, you name it.
Yeah.
I think we have it.
That's amazing. Are you seeing healthcare costs rising this year?
Unfortunately, that's the trend.
Yeah.
And that's just the trend of the country. It's not just an insurance company. There's a lot of the facilities and doctors that are negotiating their costs. They want to be paid more.
Yeah.
If you think about technology, look at what we're doing here at technology. The same goes for, the medical fields. It's, labs too. We're coming up with more and more prescription drugs, more and more different types of treatments for those cancers. It's out there. It's one of the things that we try to do here, though, at GMS is when we're looking at how much can we take on as far as that insurance plan and not pass that whole cost of that out to our clients.
Yeah. And I think there's a lot of business owners that feel that same way with, maybe the increased cost of goods or tariffs or things like that. They're looking at the same thing within their business. Like, how can I maybe take on some of this cost so I don't have to pass it on to my consumer? So I think the heart of it is very, very similar to what a lot of business owners are dealing with now.
Yes.
Any advice you would give to business owners as they're looking at their renewals when they start to come in from their brokers? What is the major thing that you want them to know?
Ask the questions.
Okay.
Can they answer, why am I seeing this increase? Is it my group? Is it just as a whole? Be very cognizant of what those plans are too. Just a lot of times we see them come in and they focus on a percentage. I'm having an increase of 11%.
Yeah.
Well, I think the best thing to do is to break it down dollar by dollar.
Okay.
And that's something that I like to do with my clients. And when you break it down, dollars in, dollars out, then that 11% doesn't sound as bad.
Right.
And especially if they have a contribution and employees have a contribution, to look at how that's going to affect on either side.
Right.
And sometimes it's not that bad. But, don't always just focus on a percentage. Really, really, grind out the dollar amounts.
Love that. Great advice, for sure. Well, Amie, it's a pleasure having you on today.
Thanks,
Thank you so
Alyse.
much for joining us. If you're a business owner listening and you want to get a hold of GMS and just ask, hey, can I get a quote, healthcare quote at renewal? Happy to do that. Please just visit us at www.groupmgmt, that's groupmgmt.com. And request a quote. We have it right on our website. And I'm sure Amie and her team would love to talk to you.
Absolutely.
Thank you so much. And please join us at our next one.
Thank you for tuning into the People's Podcast. We hope you found today's discussion helpful. Stay tuned for more insights in our next episode. For more expert guidance and resources on small business management, PEOs, and more, give our podcast a follow. Find us on social media or visit us at groupmanagement.com. That's groupmgmt.com. We're dedicated to helping small businesses everywhere make their operations simpler, safer, and stronger.